So they're likely not the first group that comes to mind when you think of housing insecurity, but this is the Bay Area, and this is a group of frontline doctors at Stanford that tell our Max Darrow they're struggling to afford even basic necessities as they work up to 80-hour weeks.
When he's not working long hours, Dr. Ivan Mayer is either studying up.
In medicine, you never stop learning.
Or often tidying up. He's a third-year resident physician at Stanford Hospital, a husband, and a dad.
The experience of being a father and being a resident is actually intertwined with me entirely. I've never been one without the other.
He takes pride in both roles. Neither are easy jobs, and he knew that going into them both. But what he didn't quite comprehend was how deep of a financial hole he'd find himself in working as a young doctor at one of the nation's premier hospitals.
I had to take out a $30,000 loan in addition to my over $100,000 in debt from medical school just to survive that first year of residency. In order to pay for rent, in order to pay for food, and just to make ends meet.
After having their child, Mayer's wife had to stay home for medical reasons for a while, making him the sole earner in their household.
We were $300 away from qualifying for food stamps as a doctor, and you wouldn't really think that would be the case, but that's how close we were.
Their saving grace, he says, was his wife getting a job in tech.
And sometimes I feel like luck was on our side, but not everyone can be as lucky as we were.
Fair contract now!
So he and hundreds of other Stanford Health Care resident physicians and fellows represented by the Committee of Interns and Residents are trying to change that reality. They recently came together for a march on the hospital, a unity break. It wasn't a strike or a work stoppage. It's a union strategy commonly used during negotiations to draw attention to the bargaining process. The physicians are demanding better pay and better benefits as many are drowning in debt and struggling to make ends meet.
Stanford makes hundreds of millions of dollars in profits every year, and it's unimaginable that what we're asking for is unreasonable.
As of mid-July, there have been 14 bargaining sessions with 9 tentative agreements, according to a Stanford Health Care spokesperson. However, Mayer and colleagues feel that Stanford has not bargained in good faith.
They've been stalling a lot. They've been withholding information. The most recent package that they actually offered to take away benefits that we already have.
We requested an interview with a representative from Stanford Health Care. They provided us with a statement, reading in part, "Throughout negotiations, we continue to reinforce our commitment on a number of important topics, from prioritizing highly competitive wages and benefits to ensuring the safety of our house staff if they are too fatigued to drive home at the end of their shift."
You know, I understand that our demands may not necessarily be met, but at the same time, meet us halfway, come in good faith. That's all I would ask.
Mayer says the less focused the resident physicians are on making ends meet, the more focused they can be on their patients in their time of need.
According to a union spokesperson, the next bargaining session is tomorrow afternoon.